Hello, this is David Schwab, and I recently had the great experience of interviewing Dr. Andrew Alpert. Dr. Alpert is a periodontist in Aventura, Florida. We conducted the interview via Skype. Dr. Alpert provided just great answers to frequently asked questions. Here's a portion of that interview. I understand that there are new ways of providing bone using growth factors. Could you tell me more about that?
You're absolutely right, David. There are, in the last 5 to 7 years, there's been an entire uh, arsenal, you might say, of products that enable us to grow bone very rapidly. These are growth factors that are found in the proteins, and we get them in our blood. We can use our own blood, okay, to provide for these proteins that provide for growth factors, or there's growth factors that are manufactured in laboratories. So what we typically do is we incorporate these growth factors without getting too fancy. One of them is called platelet-derived growth factors, PDGF. That means that the platelets, okay, that are in our blood have these growth factors that encourage the bone cells that are in the blood to become mature and create new bone. We need the new bone for the dental implants. So once again, we can use our own blood, or we can use these growth factors that are found and made in a laboratory. It's a whole arena, okay, that's out there now with growth factors, and it's going to be the entire future of our profession.
I understand that in the early days of implants, there were some patients who were told that they just weren't candidates for dental implant treatment. But nowadays, it sounds as though you can provide the bone.
If I've heard that I'm not a good candidate for dental implants, one time I've heard it maybe 500 times or 1,000 times in my practice. Patients are told this day and yeah, well, you're not a good candidate for dental implants because you don't have enough bone. And I tell the patients the exact opposite. I tell them, you know what? We can always make you a candidate for dental implants. It's just a matter of how much bone we have to grow. That's what it takes. So there's certain procedures that are easy, fast, limited surgically in terms of growing bone, and some of them are very vast. Sometimes we have to take bone from outside of the mouth. Sometimes we take bone from tissue banks. Sometimes we use bone that's made from a laboratory. But you have to have bone. So we can take a patient who has a very thin amount of bone, either in a horizontal, it's called, direction, or a vertical direction, that means top and bottom, or sideways, and we just grow the bone. Now, that takes longer many times than the implants, and is actually the more demanding part of the procedure. But everybody can be a candidate except if they have uncontrolled diabetes. That's what we talked about earlier.
I want to thank Dr. Alpert for joining us today and sharing his expertise. Dr. Alpert is accepting new patients, and he may be contacted through his website, alpertdentalimplants.com. This is David Schwab. Thanks for watching.